Hey everybody, today we're talking about blood, very important for realism, and today we're just going to be showing different types of blood, there are different tints out there are just different everything. So just wanted to show some of the ones that we work with, and you can probably see that nice deep color there, and it looks nice, it's fresh, okay, and that's fine and dandy. So again, what's important is that when selecting products, we work with only nice qualified vendors, and they treat us right, and we're very thankful to work with great people. So simulated blood is very well, sticky. It can be tricky too, because you want stuff that is basically going to be able to wash out. You want materials that are going to be skin safe, and that that are not going to leave a lasting stain. Now, there are various different products on the market, and all of them claim that they don't stain. I don't know how I feel about that one. I think that there's a risk of staining with any simulated blood, just because of the intense skin tone and so on. So I'm going to move those guys over there, and we're just going to kind of sample a little bit, and we're just going to test some out. Just wanted to show you a little bit about just different types. So you can get different colors. You had your base colors. You can also have something that has maybe like a yellowish tint to it. Let's see how that pulls out. Okay, maybe if somebody has a hepatic or a liver disease, that could be an indicator. Let's see how that dries. We can have ones that have more of a red tint to it, and let's just take a look at that, see how that shows out. Okay, some of these products, it does take a few moments for the tints to actually come out. You can also do something like a little bit more blue, something darker to simulate something deoxygenated or maybe even arterial, and you can just see that one just a little bit more. Okay. What's really important, especially like in your surgical cases, people are looking for clots and the ability for blood to clot. And there are a lot of home uses that people use. Again, we like to use something that is more tried, tested, and true, and has been actually certified that way. So here's something that's actually thicker blood, and that you could just basically make it into a clot, and you could just test it out however you want to. As you can see, it retains the shape, and yeah, it's pretty thick stuff as compared to the other ones. Let's go on the other end of the spectrum here and do something that's a little bit thinner. Okay, and again, so different concentrations really will give you different effects, and depending on what you're looking for, really the sky's the limit. So rather, if you're looking for something that's kind of basic, just different tones for effects purposes, or different actually tones within the blood, you can see some of that darkness coming out with the blue as compared to the uppers. And also there's your nice clotty ones, and then there's also your thinner ones. So just wanted to share some of that with you today, and if you have more questions, feel free, drop us a line in the comments, give us a shout, send us an email. We're happy to help.